Hello, my name is Paula Rodríguez-Otero. I work at the University of Navarra in Pamplona, Spain, and it is my great pleasure to give you a summary of this presentation given at the last European Hematology meeting about the combination of Teclistamab, which is a B-cell maturation antigen bispecific antibody, with Daratumumab for the treatment of relapsed refractory multiple myeloma. So we know that despite the recent advantage, myeloma patients who relapse still are in need of novel therapies, and Teclistamab is an off-the-shelf BCMA CD3 bispecific antibody that has shown very impressive results in the phase 1 Majestic trial. In this study, we are combining Teclistamab with Daratumumab in the basis of a potential synergistic efficacy due to the immunomodulatory actions related to Daratumumab. So this is the study design. Patients were included if they have received at least 3 prior lines of therapy, including prior exposure to a proteasome inhibitor or an immunomodulatory drugs, or were refractory to these 2 agents. Prior anti-CD38 monoclonal antibody therapy was allowed, but there was a requirement for a 90-day washout period before enrollment. So 3 different doses of Teclistamab has been evaluated so far with in combination with a standard dose of Daratumumab. In total, 65 patients have been included thus far, and the primary objectives of the study was to identify the recommended phase 2 dose for the combination, and also to evaluate the safety and the efficacy of the combination. So these are the patient baseline characteristics. So median age was 67 years, and a significant proportion of patients were exposed to prior anti-CD38 monoclonal antibody therapy, 75%, and also refractory to prior anti-CD38 monoclonal antibody therapy. The median number of prior lines were 5, and also close to 60% of the patients were triple-class refractory. So this is the safety overview. So the combination was well tolerated with no overlapping toxicity. Most frequent hematological treatment-related adverse events were neutropenia that were grade 3 or higher in 41% of the patients, and cytokine release syndrome, which is a well-known adverse event related to T-cell engager therapy, was present in 67% of the patients, but only grade 1 or 2, and confined to the step-ups and the first full dose of treatment. Regarding the majority of the events, as I mentioned, for cytokine release syndrome were grade 1 or 2. Regarding efficacy, overall response rate was 76.5%, and 70.6% of the patients achieved at least a very good partial response, with a median follow-up that is now close to 9 months. Responses were very rapid, with a median time to first response in the first month, and seems durable, as you can see here in the swim lane plot, with 67% of the patients that responded to therapy is still alive and on therapy at the data cutoff. So this is the pharmacodynamic data highlighting the efficacy of the combination of the 2 drugs. So as expected, after Daratumumab dosing, there was a decrease in the CD38 positive, CD8 positive T cells. But despite this initial decrease, the addition of Teclistamab on cycle 1, day 2 was able to induce the T cell population, and overall the pharmacokinetic profile was comparable to that of the Teclistamab single agent evaluated in the Majestic 1 trial. So we can conclude that this combination of Tec plus Daratumumab is a novel immunotherapy-based approach, yielding high overall response rate in a population of relapsed refractory multiple myeloma, heavily pretreated, with an overall manageable safety profile. Thank you all for your attention.